sometime last year, 2021, and we treated her for radiculitis, or a pinched nerve in the neck that was radiating down the arm. And then also we treated her for tennis elbow. So she's got both going on, and it's really important to be able to determine which it is and to be able to use the right tools to get to the bottom of these conditions. Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. We have Marion here, and Marion has an interesting case. She has tennis elbow. So for those of you that don't know what that is, that's tendonitis, overuse of these muscles here in the forearm, in the elbow area. And then golfer's elbow is when you get it on the inside. So I'm gonna give her some exercises to do for the tennis elbow or the tendonitis, but I wanna show you how a chiropractor treats tennis elbow very differently. Number one, we know she has pain in both elbows, but she complained of pain in her upper arm, up above into the shoulder on the left side. And in the past, she has had a pinched nerve in her neck. So she's got two things going on. She's got radiculitis, or pinched nerve in the neck. And those nerves in the neck run down into the shoulder and all the way down into the arm, hands, and fingers. And they can mimic tennis elbow. So we want to make sure that we rule out pinched nerve in the neck. And she definitely has arthritis in the neck, some disc degeneration in the neck, and a pinched nerve or two in the neck, and sometime last year, 2021, and we treated her for radiculitis, or a pinched nerve in the neck that was radiating down the arm. And then also we treated her for tennis elbow. So she's got both going on, and it's really important to be able to determine which it is and to be able to use the right tools to get to the bottom of these conditions, because with her it could be confusing, and you could be treating the elbow and the elbow doesn't get better, especially if it's coming from her neck, and vice versa. So we treat both, of course, but I'm going to show you how we rule out the tennis elbow. Number one of the best ways is just to palpate right here. And if the patient has pain in this part of the elbow right here, then it is tennis elbow, or even down in here in the forearm. Okay, if it's sore or really painful, you know it's tennis elbow. Another way is to check the elbow, the integrity of the elbow joint itself. So we're going to go ahead and check that, and 1, 2, 3, resist. Good. Did that hurt?
No.
And 1, 2, 3, resist. Good. And I just checked the radial head. Now I'm going to go ahead and check the ulnar head. 1, 2, 3, resist. Good. Any pain when I do that?
No.
Okay. So I know, and everything tested strong, I know the elbow joint is intact. It's in place. There's no subluxations. There's no misalignments. And if there were, one of these muscles would blow out weak, or it would be painful. When a joint is out of place, the adjacent muscle goes weak. That's how we know that. So we're going to go ahead and check her other elbow, because she has
This one is out of place. So
tennis elbow in both sides. And 1, 2, 3, resist. Good. And 1, 2, 3, resist. That hurts. Okay. So that hurt right from the start, and that was checking her radial head. And we're going to go ahead and check the ulnar head, and 1, 2, 3, resist. And that, okay, that was strong, so it didn't come out of place or anything there or go weak. So we're going to adjust the radial head here, and just relax yourself here. Okay, now we're going to go ahead and test it. And the beauty of it is it's a huge difference right after. If you corrected it, there'll be a big difference. So we're going to go ahead and check, and she had a lot of pain. 1, 2, 3, resist. Well, she didn't wince, she didn't scream. No. So how was that? Did it?
It was a lot better.
A lot better. Okay, so we just adjusted the radial head. That's one approach to tennis elbow, but it's not going to be enough. So another approach is using one of these tools, the scrapers, Graston technique, which we did on you last time. But today we're going to do something different. What we have is cold laser therapy. Laser therapy is a step above the rest. This actually reduces inflammation and heals and repairs soft tissue damage much faster than anything else can. And I have two of them. So we're going to sandwich both elbows with a laser treatment, calm the inflammation down, and that's pretty much it. So we're going to laser all along the tendons there on the lateral aspect of the elbow, and on the inside of the elbow a little bit as well. And that's how we treat tennis elbow or golfer's elbow in this situation. If you guys have any questions or comments, don't be afraid to just comment below. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't Don't forget to subscribe. Appreciate you guys.